So, and in your opinion, I know you used to work in the community outside of the VA also. Comparatively, is the VA offering more services or better services, or how do you see the two?
I think that we offer similar services. I think that the VA is really focused on serving the veteran. I think the one thing that for me drew me to the VA from the private sector, although I had trained at the VA, was that the fact that the care is more comprehensive in terms of the fact that I have access to that person's full medical record. I can see if people are refilling their medication. So if I'm treating someone for glaucoma and their pressure's not where I would want it to be, and I say, oh, I see you haven't refilled your drops in 9 months, that, I'm going to have a better idea of whether or not it's really that there's a treatment failure with the medication versus the person's being challenged and being able to use the medication in the desired manner. So I think that part of the healthcare being completely integrated and the fact that we're able to freely refer to another practitioner, another specialist.
That team approach that we talk about so much in the VA.
Absolutely, being able to reach out to a primary care provider's PAC team's nurse or that provider, just really, I think the VA has better communication.
Okay, great. And I know if I'm calling my optometrist out in town, I'm looking at a wait. It's years ago, maybe it was like, oh, I get you in next week. Nowadays, it's not the same way. And I utilize the VA for almost all my care now. And I do notice, we have a wait time too. It happens with the best of them. But I notice when I call for an appointment, I get in fairly quickly. It's not 2 and 3 months down the road in some cases.
Obviously, I have metal in my eye, or all of a sudden I have flashes and floaters and I can't see out of my left eye versus, my glasses are a little scratched and I need a routine eye exam. Well, all of these things are important. And obviously we want to help people with all of these things. But there's a level of urgency that, obviously determines how quickly somebody's going to be seen sometimes. And it's true, this 2020 was a difficult year, whether you were in the private sector or the VA. Basically, it was 9 months of lost services, and you still can only see so many people in one day. And we're disappointed when our patients are disappointed, our veterans are disappointed that they can't be seen exactly when they want. And I appreciate that a lot of people want to schedule multiple appointments on one day.
Yes.
Because they're traveling or they're elderly and somebody's giving them a ride, and I understand that.
Well,
but
in
it makes it
rural areas, it can be very difficult.
It makes it difficult sometimes, when people have 3 or 4 appointments in a day to try and, just get one more in there.
Yeah, sure, of course.
The free VA New England mobile app is empowering those who served our country like never before. Access up-to-date information on benefits, healthcare, home loans, and more. Search VA New England in your app store today and access the benefits you've earned and deserve.